Before Dr. Jim May comes up to make the Constable Eulogy, I'd just like to say a couple of words. As you know, John Constable passed away last year, and I thought, although I didn't know John Constable, I thought it was important for membership, the AAPS, to be visible at his memorial. So I went to Boston, and I was absolutely amazed at the turnout for his memorial service. This memorial was attended by probably 500 people, and it was really a who's who from AAPS and from plastic surgery. So this was obviously an amazing man. And then the eulogies that were given were actually spectacular, but none was better than the eulogy given by Jim May. And so Dr. Jim May is going to come up and say a few words regarding John Constable and the wonderful contribution that he made to the association and to plastic surgery.
Good morning. Jim, thank you for that introduction, and your presence at the memorial service for John was greatly appreciated by all, in particular his family. Thank you, members and guests, for this opportunity to speak about a friend, John Constable. Eulogy, the word, is from the Greek word eulogia, which means to praise. In this deliberative rhetoric, I intend to give each of you a view of a remarkable man with whom only a small number of us had the opportunity to know well and to work with directly. On June the 6th, 2016, John Davidson Constable died in his 88th year of life at his home in Sherborn, Massachusetts. With John was his wife and family who had supported him over the past several years prior to his death as he battled Parkinson's disease. John was born in London, England, to Olivia and William Constable, and when John was a teenager, he and family relocated to the Boston area as John's father was appointed curator of the Museum of Fine Arts in Boston. John's intellect and his curiosity led him to Harvard College and then on to the Harvard Medical School. He was accepted as a surgical intern at the MGH in 1953 and ultimately ascended to the chief residency position on the East Surgical Service in 1959. John completed his plastic surgery training under Dr. Brad Cannon in 1961 as Dr. Cannon's first resident. John was thusly the first and the only general surgery chief resident at the MGH to go into plastic surgery, and John was Boston's first locally trained board-certified plastic surgeon. John served his entire clinical career at the MGH and was the busiest plastic surgeon at our hospital, covering the broad spectrum of plastic surgery. He also served as chairman of the Shriners Burns Institute, the Mount Auburn Hospital, and was a consultant with many other hospitals in the United States and abroad. As a resident at the MGH, I observed that when John was consulted about a clinical problem, he would always say, "Where's the patient? Let's go see for ourselves." This approach taught that we as surgeons are not treating a diagnosis, but rather are caring for a patient with a problem. The treatment for that patient lay not only in textbooks or on board exams, but rather was guided by the patient's symptoms, the patient's findings, and most of all, the patient's desires. This was the secret to John Constable's razor-sharp clinical judgment. John was truly a Renaissance man with interests broadly cast across the spectrum of human endeavor. He was equally at home in discussing Asian ceramics as he was leading a birding exposition on the coast of Maine or in Madagascar. I cherish the times that I scrubbed with him, not only to learn plastic surgery, but also as a chance to view worldly subjects and a broad spectrum of events through the eyes of a brilliant observer and participant. Throughout his career, John was seen as a role model by his colleagues and his trainees alike. His opinions about the full range of plastic surgery were sought often. Remarkably, other friends of John's and associates outside of medicine barely knew of his medical career. He was not a self-promoter. The common trait in John's engagement in any field where he was active was his insatiable enthusiasm and intelligence. He always gave of himself in every area of his involvement. In 1983, John received the prestigious Golden Door Award in Boston. This honor is given by the New England International Institute to a single awardee annually who has extended himself and provided an increase in the quality of life of individuals around him. The evening that this award was given, I observed that the 7 people speaking on John's behalf were represented by many, many fields of interest. Only one was medicine. The other 6 experts speaking on John's behalf represented fields far across the biologic, humanitarian spectrum of human interest. I learned that evening of the remarkable breadth of John's impact on those with whom he worked, served, and learned. I saw also that that man who was my surgical role model was in fact seen by others as an expert in their fields, who just happened to be a surgeon. This epiphany encouraged me and all of John's trainees to expand our interests beyond plastic surgery and to hopefully become better balanced people. In 1972, John was elected to our association. Over the years, his teaching and international cultural exchange became known and appreciated. He was one of the first to recognize that surgical cross-fertilization was a powerful currency in our never-ending efforts for different peoples to understand and respect each other. In 2008, our association established the John Constable International Fellowship in Plastic Surgery. This fellowship allows international fellows to come to the U.S. to enrich their training and to foster cultural exchange. Dr. Bartlett, our current Constable Committee Chair, will expand on this in a few moments. John leaves behind his devoted wife, Sylvia, who could not be with us today, and their 3 daughters and their families. Thank you, John, for your individuality, your mentorship, and most of all, your friendship. You always led by example. Your persistence and presence will be missed and never forgotten. Thank you.
Thank you. I alluded to this yesterday about the John Constable International Traveling Fellowship when we made the awards. And I wanted to just highlight and take this as an opportunity today to talk about how important that fellowship is to global surgery and to this organization. And a lot of this information you may have seen, most of it came from 2 sources, the Lancet and the World Health Organization. And John was really prescient in seeing our obligation to the international community well before it became vogue to become part of, quote, global surgery or global medicine. He was doing it years and years and years ahead of the pack. And these are data, you can all read the slides from the WHO and the Lancet, that the global burden of surgical disease is huge, and if you look at those areas that we can contribute, it's in congenital anomalies and injuries and trauma. And if you look at this worldwide, 5 billion people lack access to safe, affordable surgery. And what can we do? If you look at these data, I think this sentence here says it all. Untreated conditions result in high mortality. Minor surgical pathologies become lethal. Treatable injuries progress to death. And the WHO has put out guidelines as what we can do at a country level. And one of the things that they have come to are those two things that I've outlined here: strengthening the surgical workforce and infrastructure, and fostering global collaboration and partnerships. And how do you do that? You do it by fostering training in surgical care. You use global networks and partnerships which encourage surgical capacity building. And that's exactly what we're trying to do with the Constable Fellowship. And the coordination between health ministries, non-government organizations such as ours, international organizations, and academia to solve this global problem. John, as I said, traveled widely. He did this at a time when it was not the vogue thing to do. This is a picture of John in Vietnam during the Vietnam War, in North Vietnam, taking care of patients with burns, napalm injuries, and the like, using techniques such as this. And he was going there, but he recognized that really the way to solve this problem is to bring those people to our country, teach them, and let them go back and practice in their own country. And this is one of my favorite pictures of Michael Moses, Brian Toth, and John on the streets of Vietnam well back in the early 80s. So please make a contribution to the John Constable International Traveling Fellowship. Make this a part of your giving plans in memory of John D. Constable, who was our friend and colleague. Thank you very much.